Okay, we're recording, and I'll turn over to Dean, who's going to introduce Donna.
Welcome, everyone. I'll just add my welcome to Ed's. And I'm pleased to introduce the moderator of today's panel discussion, Donna Canistero. She's a board member of the Emeritus Center and has put together a wonderful panel to discuss this timely topic. She is a certified project management professional with large-scale business and technical environments. She is the owner of DSC Leadership Consulting, LLC, specializing in thought leadership seminars, project management consulting, and strategic planning and governance. She is also an adjunct professor in government information strategy and management, a nationally ranked academic program offered by the Rockefeller College of Public Affairs and Policy at the University of Albany. Donna will now introduce our panelists and begin the program for today.
Thank you, Dean, and welcome everyone, and thank you for attending today's topic. As Ed and Dean said, the topic is going to be the challenges of providing services to the intellectual and developmental disabled community within today's political environment. Over 119 individuals within New York State alone have some form of intellectual and developmental disabilities. According to the New York State Office of People with Developmental Disabilities, OPWDD, who is the Overwatch agency providing services are provided to New Yorkers with developmental disabilities through a network of over 500 not-for-profit service providing agencies, with about 80% of the services provided by not-for-profits and 20% by state-run facilities. There are many challenges facing these organizations. In a traditional budgetary year, overall government budgetary cuts, changes in legislative mandates, rate rationalization, and the high turnover rates of their most critical workforce of direct support personnel, which we commonly call DSPs. Add now to this mix living through the challenges faced by all healthcare systems, COVID-19, and the aftermath of having to protect a most vulnerable population. This year's budget crisis has also laid a heavy burden on these organizations as they continue to see budget cuts across the board. This panel will explore the political and policy environments organizations face as they adapt to this new landscape, with the ultimate goal of non-interrupted services to the individuals they continue to serve. I'm pleased to introduce our panel to you. First, I would like to introduce Assemblyman Angelo Santa Barbara. Angelo was elected to the Schenectady County Legislature in 2017. He held public office as a Schenectady County legislator for 5 years before being elected to New York State Assembly in 2012 as the first assemblyman to represent the newly created 111th district, which includes Montgomery County, parts of Schenectady, and Albany counties. He was reelected in 2014, 16, 18, and 20. As a member of New York State Assembly, he serves as the chairman of the Subcommittee on Autism Spectrum Disorders, chair of the Commission on Rural Resources, and as a member of the Agriculture, Energy, Government Employees, Mental Health, Racing, Waging, and Veterans Affairs Committee. He has a Bachelor of Science degree from SUNY Albany, our alum, and is a licensed professional engineer. I want to welcome Angelo as being part of our panel today. I'd like to next introduce Eric Geiser. Eric Geiser has more than 2 decades of progressive experience in management, quality improvement, and policy development, and compliance training, internal controls, and investigation in the public and private sector, with a specialization in healthcare, managed care, and services for individuals with disabilities. He is currently the Chief Executive Officer for the ARC of New York, the country's largest not-for-profit organization for people with developmental disabilities, serving approximately 60,000 individuals in New York, employing 30,000 people with an annual revenue of more than 1.8 billion. Eric was previously the Director of Operations for NYC Behavioral Health Organization with United Healthcare. His role was implementing and overseeing all aspects of behavioral health, Medicare managed care division, and was implemented as part of the governor's Medicare redesign team. Eric is a licensed medical health clinician, a certified fraud examiner, a certified government audit professional, and a certified healthcare compliance professional. He's a graduate from SUNY Geneseo with a master's from SUNY Albany as well. Next on our panel is Jennifer Saunders, CEO of Liberty ARC, the Montgomery County chapter of the ARC, New York. Liberty ARC is a not-for-profit corporation with a $58 million budget providing support to persons with disabilities in Montgomery County, New York. Liberty supports approximately 550 individuals with disabilities by offering residential, day, vocational, family support services. Liberty is the second largest employer in Montgomery County and employs over 700 individuals. Prior to serving as Chief Executive Officer, Jennifer held the position of Chief Financial Officer at Liberty for 8 years. Her education includes a Bachelor of Science in Accounting from Alfred University, and she obtained her certificate of public accounting. And she has worked in public accounting in Philadelphia prior to moving to the not-for-profit industry. And last but not least is Stephen Fuller, who is Vice President of Programs for Special Olympics New York. In the early 1990s, Stephen graduated from State University of Brockport with a Bachelor of Science degree. His career began in the field of human services, providing support for people with developmental disabilities. He worked as a recreation therapist and later moved on through many levels of his organizational leadership, having focused on program development, organizational structure, and strategic planning. Steve joined the team at Special Olympics in 2004 and has led the reorganization of the first two super regions, Geneseo and Western. As Vice President of Programs, Steve currently leads the Sports Health Unified Movements for Special Olympics New York, inclusive and expanding programs. Over the past 2 decades, their organization have embraced dynamic change to benefit the athletes and the stakeholders. So I want to welcome you all to our panel, and I thank you so much for being part of this. As we discussed, what we are going to do is I'm going to turn the program over to Assemblyman Santa Barbara to start, and then we'll move through each panelist. As Ed mentioned, if you do have questions, please hold for the question and answer period by raising your hand. So I'd like to turn the program over to Assemblyman Santa Barbara, and I thank you for being here.
Great. Thank you for that introduction. And I think we got a great panel, a lot of good comments I think are going to come out of this. A lot of good is going to come out of this discussion. And I want to thank you for the opportunity to speak with all of you and to talk about the challenges facing the disability community and healthcare workers who provide them and their families. Let's not forget about their families as well. They support the individuals and their families with invaluable support. We all know New Yorkers with intellectual and developmental disabilities face unique challenges, many of which have only been exacerbated by the COVID-19 pandemic. I have my son, Michael, who we went through a lot of the challenges that we're talking about here, will be talked about here today, anywhere from education to life skills to pretty much his entire day was disrupted, and it was very difficult. But now we're on the path to recovery. We're seeing a lot of support for various parts of our community. And as we continue on that path, the state legislature, the governor's office, everyone that is working to help our communities recover, we can't allow them to leave individuals with developmental disabilities behind. Unfortunately, what we've seen, and this has been talked about many, many years, that many of the nonprofits that serve these individuals have not seen the support from the state capital, from the state budget. And they've also been some of the first to face budget cuts that threaten to limit their outreach and further prolong the staffing crisis that has gone on for years and years. For me, I know firsthand how important these organizations are. I visited, it's great to have Jennifer Saunders here, Liberty ARC, Schenectady ARC, the organizations that serve my assembly district. So I know the impact that they have. I know how important it is that they have the support they need. But I also know that they are facing that crisis. The turnover rates, the vacancy rates are there. again, for me, my son Michael, he's lived with autism his entire life. He's always needed the supports and services that we're talking about. He was diagnosed at age 3. And I've been fighting as a father before I was elected to office. And now as a state representative, I've been working to ensure that kids like him, people like him, adults, the many people that live in our state with developmental disabilities, that they have the resources they need to reach their full potential. And we've seen this when support is there, when the funding is there, we see that people can achieve their dreams. So if that doesn't happen, that's our fault. Something's gone wrong, whether it's the state budget, whether it's policy, something has gone wrong somewhere. So for me as a father, as a state representative, I'm always going to fight to ensure that people that sometimes don't always have a voice for themselves, that they have that voice at the state capitol. I can recall last year, the Advocates for New Yorkers with Intellectual and Developmental Disabilities rally, the fight for a 5-year, 3% annual increase in the state budget to safeguard these services. These are things that are long overdue. These are things that have to happen. And I'll point back to the previous administration at the state capitol. We did not see much support from the executive chamber. With the new governor, maybe we'll see that change. I'm hopeful that we will. I've written letters to our commissioners. I've written letters to the new governor. Unfortunately, what we're seeing is on top of these funding cuts, the financial fallout of COVID-19, coupled with the years of neglect to the direct support professionals field, has led to a severe shortage of workers and alarmingly high turnover rates. And I hear this from my organizations, but it's not just here, it's across the entire state. They are essential workers. They take on the difficult, selfless job of providing 24/7 care for so many of our family, friends, and neighbors with disabilities. And I say this often that if it's not your family that's directly affected, chances are there's somebody in your community, the family, a friend or a neighbor, someone out there is affected by these services. So as you can imagine, if we lose these services, it's really devastating to our community. And when we talk about recovery, putting funding into this industry, into these services, really helps our community. It really helps us get on the path to recovery. It provides more employment opportunities. It provides a number of other things. And most importantly, it helps people find independence. And there's nothing more important than that. They serve as our direct lifeline to go above and beyond. They help people get involved in their communities and live fulfilling lives. The job requires immense dedication, a high level of responsibility. And yet DSPs working, I know here in upstate, they work their wages are below minimum wage, and they have little room to move up in their career. The work they do is truly life-changing, yet they've been denied a living wage, a chance for growth, and the respect that their role deserves. It's really shameful what we've seen at the state capitol, the lack of investment, but hopefully we'll see that change with the new administration that's there now. It shows everything we've talked about so far here today and everything we've talked about over the years and COVID, it shows that real change is long overdue and it's needed. This past summer, I hosted a rally in Schenectady at Proctor's with Schenectady ARC. We called for those fair wages and better opportunities for DSPs. We heard from them. We heard the people that stay there, even though it doesn't make financial sense for them. They stay there because they have a passion for this work, because they want to help people. So it's our job to make sure that we're doing the right thing here. As I said, I also wrote a number of letters to Governor Hochul, urging her to stop the funding cuts, rescind the vacancy adjustment for residential providers, and increase the wages for DSP, something that is long overdue. This is a great opportunity for our state to shine bright and to make investments in this upcoming state budget in the direct care field. This will not only help us get out of the current crisis, but it'll help us recruit and retain more DSPs that are so desperately needed. For myself, as chair of the subcommittee on autism and spectrum disorders, I'm a member of the mental health committee as well. You can be sure that you have my commitment to ensuring our state's recovery plans include solutions to better support DSPs and the residents that they care for. There's still much work to be done, but you can be sure I'll continue to be a voice for our most vulnerable. Both here at home and in Albany, I'll always fight for a stronger, more inclusive community for all of us. I want to thank you for this opportunity to join you on this panel and to speak with all of you. Thank you.
Thank you, Assemblyman. We do have a champion in you, and we'll be talking later. One of my questions is how do we engage others of your colleagues to become champions as well? So thank you very much for your time. I'm going to turn the program now over to Eric Geiser, the CEO for the ARC of New York. Eric, good afternoon.
Good afternoon. Thank you, Assemblyman Santa Barbara, for your comments and also your leadership. And I also want to just take this opportunity to thank Donna, Dean, and Ed for holding this event and asking me to be a part of it. As Donna indicated, I am the CEO of the ARC New York. I am a product of the SUNY system, Albany, and undergraduate at Geneseo as well. So a wonderful institution. So it's an honor to be here. A little bit about our organization. We're a family-led organization. We advocate and provide supports and services, as Donna said, for a huge number of individuals in New York State, 60,000 approximately. We have 36 operating chapters, and one of our CEOs is here today and will be speaking with you after me, Jennifer Saunders from our Montgomery chapter. But we provide services in all 62 counties in the state. And as I said, we employ over 30,000 people. Our organization started in 1949, so we've been in existence over 70 years. We've seen massive transformation and progress in our field, and we've developed a comprehensive system of services for individuals with IDD. New York has an ethical and legal obligation to provide essential services, high quality services, and integration for people with IDD. Our support is non-negotiable. However, as you've heard, decades of fiscal pressures compounded by COVID have severely destabilized our system, and we must take decisive action now to preserve it. Any discussion about our budgetary priorities has to start, of course, with the impact of COVID-19. A study by Syracuse University, which was conducted in collaboration with our organization, our data, and our assistants, found that individuals with IDD are 4 times more likely to contract COVID and 2 times more likely to die from it. The impact of the pandemic became the source of national news stories. Specifically, one group of specialists stated in a letter to the American Journal of Psychiatry that people with IDD were disproportionately isolated prior to the pandemic, and the intensification of that isolation stands only to weaken the community for all citizens. I'm proud of our organization's efforts in collecting the data used for advocacy at both the state and federal levels. Our advocacy resulted in prioritization of vaccination for people we support, as well as our workforce. Our data helped an often forgotten population be appropriately acknowledged and protected. From the start of the pandemic, our sector really struggled to be recognized as a critical component of the public health system. Even our certified residential providers, who are responsible for keeping vulnerable populations safe and out of the hospitals. As such, we failed to receive hazard pay for our employees or to be designated as a priority in the distribution and access to PPE. Providers statewide are experiencing extensive staffing vacancies and have implemented enhanced compensation strategies to ensure our 24/7 operations. The cost is estimated to be almost $131 million, yet even that is not enough to stabilize our workforce crisis. Furthermore, we were forced to privately negotiate and obtain PPE at rates far exceeding standard norms, with absolutely no upfront financial assistance and very little logistical support from the state. That out-of-pocket cost required us to spend almost $34 million. Our organization alone purchased millions of masks, gloves, and PPE at extraordinarily inflated costs without the help of the state. Amidst all of this, in May of 2020, we learned through the Department of Health that there were proposed cuts in reimbursements for our group homes. And if implemented, that would remove another $230 million from providers already reeling with losses from the pandemic. All told, everything together, the total impact of COVID-19 on voluntary providers is over $500 million, and it's growing. We have weathered crises in the past, working with our state partners and our stakeholders. However, COVID has presented an unprecedented challenge. Our costs have increased. We face further reductions in state funding, and federal funding allocated to the state has not yet made its way to our providers. Essentially, what we're doing is we're burning the candle at both ends without a clear path forward on how to maintain services. As Donna indicated, we are also facing the worst staffing emergency in decades. The staffing crisis we face is not new, but the pandemic has exacerbated it to the point where it threatens our entire system. Our DSPs are the unsung heroes of our operations. Without them, none of what we do would be possible. Our DSPs are the backbone of our services and supports. Their activities include supporting daily living, administering medication, tube feeding, wound care, mobility supports, oxygen administration, physical and behavioral health services, and transporting our individuals to appointments and community activities. Shortages of our DSPs directly impact people with IDD and put the situation of our system in jeopardy. And the situation is dire. So what are we doing in response? Well, providers are preparing contingency coverage plans for staffing shortages. These include things like makeshift beds in facilities typically used for day program. We're also resorting to other extreme measures, such as closing programs, doubling up bedrooms, and leaving homes vacant so we can have adequate staff to make sure that the individuals we support are safe. Senior level people are covering direct care shifts, and we are running on razor thin staffing levels. And the majority of our frontline workers are women and people of color, historically disadvantaged groups for whom the state has committed to improve equity and opportunity. Without adequate funding, we cannot offer competitive wages to recruit and retain skilled DSPs that provide the foundation of a service system for 140,000 people in New York State with IDD. Without immediate action, the emergency will continue to force service reductions, program closures, and loss of supports and services for the people we serve. For years, you've heard us tell you that the future of services and supports for New Yorkers with IDD is in jeopardy. That future is here today. According to a recent NIDA survey, that's New York Disability Advocates, 48%, imagine that, 48% of providers were forced to close or reduce programs due to the lack of staff. Nearly half of all providers shuttered essential programs because they have no staff to run them. We are literally closing the door on the very people for whom it is our mission to provide opportunity. I want to share with you some pretty staggering statistics. 93% of providers saw a decrease in job applicants this year. Statewide vacancy rates in our field increased 75% since pre-pandemic levels. 25%, 1 in 4 of all DSP positions are currently vacant statewide. 39% of providers did not reopen programs due to staff shortages. And 70% of providers pulled senior and administrative staff from leadership responsibilities to cover direct care shifts. To better understand and address the crisis, we have begun to review wages across our chapters and across all of our system. We've reached some startling conclusions. In 6 of 10 regions, the median DSP wage is less than $15 an hour minimum wage for a fast food worker in our state. The median wage for DSPs across all of our chapters is only $15.31 an hour. Field-wide, the average wage for a DSP at 70% of providers is within $1 of the fast food minimum wage, including individuals with years of experience. On Long Island, one provider's starting wage for a group home was 53% lower than the living wage for a single adult with no children, based on MIT's living wage calculator. The capital region, the starting wage for a group home worker is 20% lower than the living wage. In Albany, the capital of the state, the average starting wage for a DSP supporting people in our residential programs is almost $1.50 lower than the minimum wage at a fast food restaurant, where those employees have less responsibility, less accountability, and fewer training requirements. I want to be clear, our jobs are not minimum wage jobs. These are skilled essential workers, and they're the unsung heroes of our pandemic and our field. They deserve to be respected for the professionals they are, and they deserve a living wage. Our organization recently rolled out our first ever in our history, a DSP recruitment campaign called Discover the Rewards. And I would encourage you to check it out at www.discovertherewards.com. You'll be seeing it more and more, and you'll be hearing ads on local media soon. We've partnered with New York State to build a robust system of supports and services. Our services are the cornerstone of our commitment, and our workforce is its foundation. We're going to continue to collaborate with government to identify deficiencies, to fight for equity, and for opportunity for all New Yorkers with IDD. I hope we can count on your support, and thank you very much for allowing me to speak with you today.
Eric, thank you so much for your compelling presentation and for the numbers that you shared, the daunting numbers that you shared with us. So I hope everyone has taken those numbers to heart. I'd like to now open the floor to Jennifer Saunders. As I said, she is the CEO of Liberty Montgomery County's ARC. Jennifer, good afternoon.
Good afternoon, Donna. Thank you very much. And I'd like to thank Donna and the rest of the panelists for participating today. I'm excited that we have people tuning in and wanting to learn more about this topic and engage. So I myself, as Donna indicated, I am the CEO of Liberty ARC. We are a chapter of the ARC New York. We are county bound. To simplify it, I often refer to it as similar to a franchise. I can compete in Montgomery County. I cannot go into another county and compete against another sister ARC chapter. We also do have an operation that we started in the state of Delaware because we are unable to grow here in New York State in our core services. So we do operate in 2 states at this point in time. As Donna had indicated, we have a $58 million budget. We employ currently around 700 employees, and we serve 500 to 550 individuals with disabilities throughout the county. We run residential and day program services as our core services. Our residential services range from a 12-bed home that serves the medically frail all the way down to a 1-person supportive apartment. Our 12-bed medically frail homes have around-the-clock 24-hour staffing, awake night staff who are doing things like passing medications, G-tube feedings, repositioning and bed checks every hour, things like that in a medically frail home. And then in a supportive apartment, it's providing services that are more aligned with grocery shopping, supporting a person on employment goals, maybe engaging with their community if they want to be a part of a group or an activity or a church, that type of thing. So our DSPs can serve a wide variety of roles within the organization. They have a number of different skill sets that they have to have. As Eric had indicated, there are things like medications that individuals, direct support professionals need to be able to pass. They need to be able to do things like repositioning, things that you traditionally might think are more of a healthcare or a medical professional kind of a skill set. Our direct support professionals get involved with. I also did want to mention that we have here at Liberty ARC, we have a manufacturing division. So we have about $5.5 million in manufacturing sales each year. We produce about 200 products. The core mission of our manufacturing division is to provide employment opportunities for people with disabilities. So 75% of the workforce in our manufacturing area is disabled, either intellectual, physical, or mental health disability. So that operation is a little unique for us as a chapter of the ARC New York. Most ARC chapters do not run manufacturing as well. In addition, we have a health center in which we employ dentists, a nurse practitioner, we have a podiatrist, a couple other specialties that we offer under that umbrella as well. So we are fairly complex. In preparing for this panel, I was thinking about what is our greatest challenge. And truthfully, Angelo and Eric have already touched on it, and that is really our staffing crisis that we're facing right now. Retention and recruitment of direct support professionals is the #1 challenge facing Liberty ARC and facing most providers in this field. The core of that challenge is our lack of funding for wages. As Eric indicated, most providers in the capital region are paying a starting wage of about $13.50, a median wage of about $15. That's for a person who has about 6 years of experience. When you compare that to being able to start at a fast food restaurant or as an Amazon driver or in a warehouse for $17, $18 an hour, that's a difficult financial choice for an employee to be making. So we have really struggled. Largely, it has been amplified by the COVID pandemic, but it did pre-exist the pandemic. We, for the past 10 years, have only had one COLA, which is a cost of living increase that we've received. And that COLA was for 0.0025%. So less than 1%, it calculated out to a couple cents on the dollar for each direct support professional. But we did receive that COLA in one of these 10 years. What New York State has done in recent years is provide some funding that's directly earmarked for direct support professionals. But the amount of funding has not been enough to compensate for the years of no increases. So we might get 3% or 3% increase for direct support professionals following a very active Be Fair to Direct Care campaign. That 3% really only addresses the current year increases that most employees would have received at their organizations if they were in fast food or in any other industry. It does not make up for 5 years of no funding and therefore no raises for direct support professionals. So really our staffing crisis has been building and building for years. Right now, I think that it is getting a little bit diluted because there are so many fields that are suffering as a result of COVID and employees working from home and or employees being out of the workforce for a period of time and then not wanting to return to the workforce. You are hearing about it in almost every field that, fast food restaurants don't have enough workers. Anything that you can think of, people are posting signs. Well, for us, this has gotten to a crisis level. It's gotten to a level where there's concerns about the health and safety of individuals we're supporting. Angelo had talked a little bit about the quality of life for individuals with disabilities. For providers, the reality is we're more faced with the health and safety needs of individuals, not even able to focus on quality of life. So when you're running a 12-bed home with individuals that have severe medical needs, require bed checks, require G-tube feedings, that type of thing, and you're running on staffing minimums and or unable to provide enough staff to the home, that's really a risk that the whole field is facing. And that is the level that we've gotten to. The pandemic, interestingly enough, it was definitely a stressful time. There were new regulations coming out every single day, it seemed. There were things that were developing. There was a lack of clarity about what regulation was in place. What did that regulation mean? All of that. But for our workforce, there was this gathering behind a concept that we were trying to protect people, that we had a pandemic, that, there was a lot of fear, but it actually bonded a lot of our staff closer together. As the pandemic started to resolve last summer, we started to come out of it and feel like, there might be a little easing up on the infection rates, that type of thing. We had an absolute dropout of our recruiting. So we had almost no applicants. We typically, any given month, we have around 200 applicants. We're hiring around 20 people every single month. We dropped down to hiring 1 or 2 people in the months of June, July, and August. So that very quickly put us into a serious staffing crunch. Most providers had that same experience where they just have not been able to recruit. And for providers, we came out of, sort of the COVID crisis of the springtime, only to now be facing this serious staffing crisis that frankly is a lot more concerning than the COVID crisis was. So just looking at the interplay with politics and government, we are 95% funded through Medicaid, which means that the government, through their budgeting and through the state budget, is entirely funding our services. So we're constantly having to advocate for appropriate funding, ensuring that our representatives understand our services, understand the impact of funding. Outside of the metro areas, most ARC chapters are one of the largest employers in their county. Donna had referenced that we're the second largest in Montgomery County. That's pretty typical in the more rural counties of New York State, that the ARCs will be the largest, if not one of the largest employers. So we do tend to have quite a representation, but it's just ensuring that we have an understanding between our political representatives of what our services are, what our needs are. Federally, we have the same type of a relationship with different individuals. Here in Montgomery County, we're quite lucky. Paul Tonko is, he actually lives next door to one of our residences, so he's very well educated on our services. He knows our agency quite well. He has a true understanding of what those services mean, and he's often a real champion for us in Washington, which is wonderful. One of the additional things that I think is lending itself to our staffing issue and crisis that we have is the lack of recognition of direct support professionals. They do not have a standard occupational code or a SOC code for direct support professionals. CNAs do. So when you want to go get data about the pay rates of CNAs, the education level, the tenure, the turnover, it's all readily available because it's being accumulated. Direct support professionals do not have that recognition, so we're not even able to gather that type of information. And I do think that that's a real hindrance for us. And I'm going to cut myself off there.
Thank you, Jennifer. Thank you for your insight and the words that you share about the challenges that we face at the ground level. So I do appreciate that. Thank you. I'd like to now turn the program over to Steve Fuller, who is Vice President of Programs at the Special Olympics of New York. So Steve, welcome, and thank you for being part of this panel.
Thank you, Donna, and thank you to the Emeritus Center for hosting the panel. And I am moved and grateful to hear the call to action and the advocacy that is occurring in this discussion. I think it's dead on. And I think asking Special Olympics to sit in on this is a really interesting collaboration. I think I can share a little bit from a differing or an additional perspective, not different, very consistent. I'm going to start with a slide deck. It's just to introduce our organization. People think of Special Olympics often as a singular activity in only sports, and we are a much larger entity, really hoping to ignite and power the movement in its totality for people with. Our mission is a lot. It's a mouthful, and I guess I would always wish to summarize it by saying that Special Olympics leverages sports. Sports is something that resonates with people, it resonates with community. We're doing that for a very specific group, people with IDD, and the results are related to fitness, joy, connection, and that connection is in the community. In the last decade or more, we've really leveraged inclusion to render these outcomes. And I'll talk more about that in a moment. The impact is a bit of a summary consistent with what I just mentioned. Special Olympics in terms of our size and scope. in 2020, we were able to provide 600,000 hours of service, and the value of that is about $10 million. That value would be determined by the rate that, for example, FSS might pay for a recreator to provide an hour of service. And that rate is now 10 to 12 years old that we use to try and to determine our value. You can see that in 2020, we served 51,000 athletes. But we should offer that we are also experiencing a couple of kinds of crises. One is in the number of people we're serving. The population of those 22 and over has dropped off at an alarming rate. And those people are often the same people who are being served by the community network, like the ARC, that is so desperate for support. And this is one of the parts of quality of life, or the enhancement for inclusion, that would suffer because those non-for-profit agencies desperately need support. We forecasted our census in 2021, and we believe that it'll drop to somewhere around 30 to 35,000. And the majority of those athletes are being served in school through our Department of Education inclusion program, which serves a lot of children with both with and without in school. In terms of the program that Special Olympics offers, obviously we have sports training competition. Not everyone wishes to be involved in competitive sport. We have a motor activities training program for people who have somewhat the lowest level of skill, but can still benefit from being involved in kinesthetic activity. We also serve young athletes. Those are typically people that are ages 1.5 to 2, all the way to 11. And that program is expanded. The reason that we start to touch those supporting children the ages around 11 has to do with leveraging more than just kinesthetic play, but some entry-level early sports activity as well. And those programs often happen in elementary schools, daycares, and at home, and sometimes in settings in the community, like at the YMCA. We also have a really robust Healthy Communities program. New York screens more athletes than any chapter in the world, and we produce the largest data pool related to people with in the world. So Special Olympics International generates more information about the health, the status of health for people with. The group of medical professionals that pulled together the data about COVID and the impact of COVID on people with IDD and developmental disabilities. That group were largely Special Olympics clinicians, part of an international group and a group in New York that that provides services to people with and supports Special Olympics as well in our screening program. Our athlete leadership program is something that really has the least to do with sport and recreation. It has more to do with all of the aspects of leadership, from public speaking to advocacy. And that program is at the local level, in our counties and in our regions, and at the state level. And that advocacy rises beyond the state level into the regional level in North America and around the world, and then at the global level where those the North American region sits. And we have athletes sitting on every level and speaking on every level in Special Olympics as an organization and to the community. And the last program that's highlighted there is really where we become the most inclusive in our Unified Champion School program. That's the Department of Education funded, and also something that's funded with legislative support here in New York. And that's where people with and people without participate in recreation and sport in school. The goal and the curriculum is all based on having meaningful involvement, so that it is a real investment in credible opportunities together, and something we do not just in school, but also in the community. In the next slide, it kind of illustrates where our programming touches age groups or is appropriate or impacts age groups. Our community-based program is the program that I suggest to you is in the most trouble. Our college, high school, middle school, elementary, and young athletes programs are growing. Our community-based program of people 22 and over is attriting like nothing I've ever seen. And I recall Jennifer a few moments ago mentioned that for the last 10 years, community programs have had difficulty. And I would suggest this is, from our perspective, it's 100% accurate. The decline has been, at least for 10 years, in the ability, the accessibility for people with to join our activity. And so I offer one slide here. It's I think our final slide that really embodies some of this challenge from our view. I think that there's a challenge with accessibility for people with to become involved in what really is rendering quality of life, not just in Special Olympics, but in all community activity. There is a challenge for accessibility. As I said, we've seen agency partnership attrition and a significant loss. And so I think that there is perhaps some magic, and we've had some tremendous good fortune in doing community asset mapping and building collaborative and sustainable partnerships. The agencies and the advocacy for funding, the call to action related to that for organizations like the ARC is profound. And I think that if we see an enhancement in accessibility to programming, that partnerships with colleges, YMCAs, and community organizations like the ARC will increase participation in activity and inclusion for people with developmental disabilities and intellectual developmental disabilities.
All right. Thank you, Steve. I appreciate your viewpoint and for talking about Special Olympics, because I know it is such an important part of engaging the communities. If I could ask everyone to unmute and to bring back your video. What I'd like to do now is open our group to questions. I have some pre-prepared questions, and then we'll open it up to the participants who are, I'm hoping, waiting to share their insights with you. So I'm going to start with the Assemblyman again. Could you please tell us more about the issues that you advocate for on the state level to provide support and services to the IDD community and their families, and how the general public can assist in this? How can we become more engaged?
Well, that's first of all, I want to say all the panelists did a great job. Many good points, and it's great to be a part of this today. The issues, unfortunately, a lot of it revolves around funding, and it's, as we said today, it's not something that's new, and the main objective is to get funding that's in the budget, but we also have to remember it cannot be what we've seen in the past is a commitment for what I call is a one-shot deal. And funding comes through, and I think Jennifer brought up this point, made a really good point, that then there's years with no funding. So it has to be a commitment that's recurring. So we see this with other operations that the state runs or the state funds, the operating budget. It's something that we can count on that's going to be there. And that's truly the way to rebuild and support this industry, the direct service professionals. And the other piece of it we also touched on is that we need to create career paths. So we do need to have certifications. Every other industry that we talk about has some sort of career path. And I do have a bill that speaks to this, that creates that degree program, that career track program. That people know there's going to be advancement if I further my education. So the one part, of course, has got to be pay. You got to have reasonable pay. You got to have a living wage. You got to be competitive. The other part is that you have to have a career path that the next generation can be involved with, to say, this is something I want to do. I do want to work in healthcare, and maybe it's not that you're going to be a nurse, that you're going to go into the working in a hospital. Your typical, what you think about a typical healthcare. This is a whole nother field, and if it pays well, people will get into these careers. So that's the first part of your question. The other part is, the advocacy. How can you get involved? And I've answered this question many times, and the pandemic has taught us how to use technology very well, I think, and a lot of that is not going away, whether we engaged in it or not. We pretty much had to, during the past year and a half or so here, we had to engage in different ways, and we did a good job communicating. I think we found a way to do it. We found a way to reach our representatives. We're on Zoom. We're on Zoom right now, and we're holding this, virtual, and it works. So those are the typical ways. I don't know that that people need to be re-educated on that. But one of the things I will say to all of you, and perhaps Jennifer and Eric and some of the other people that maybe aren't here and maybe listening in, is, for me, granted, look, I live this every day. I got a son who's 20. I know what this is about, but I do get invited to tour. I do get invited to the organization. So I think we should all make an effort to reach out to legislators and invite them to come and tour and talk to some of the people that are receiving support, talk to some of the families on site. I've gone to Liberty, I've gone to Schenectady ARC, I've gone to a number of different places, but perhaps, some of the other legislators that don't have that in-depth understanding through a family member or whatever it is. I think that really hits home. It really makes a difference. It's one thing to go up to the Capitol and have the rallies, which are great and they're needed, but this is more of a personal level. And I think that could really make a difference for all of us. I learned a lot about Special Olympics just listening right now, but I'm familiar with Special Olympics, but I don't think everybody is, but to have sort of that in-depth tour or discussion, I think that's something we can all do to sort of engage legislators that this is what this is really about. And perhaps we will see an increase in support. And of course, the main thing that we can do right now, what I'm focusing on as priority number one, we have a new governor, and I've written my letters. I'm making my push, and I think we should all do that because this is a new start, and maybe we'll see something different. Maybe we'll see funding get put back into the system rather than what I think in years past, money has been taken out of the system. We need to put that money back and need to make a commitment and a plan that's going to be recurring. So I think that should be the number one priority, not just a one-shot budget deal, something that's going to be recurring that we can count on, and then we have stability. Then we're able to make plans to move forward, what staff we're going to bring in and what we need, because now we have funding that we can count on, not just this year, and the next 2, 3, 4, 5 years, we can say, someone that comes on, you are going to be able to get those raises. We are going to be able to do that for you. Here's your career plan, just like any other business operates. So I hope that answers all you. I think I answered both parts. So
Yes, you did. Thank you.
Okay.
And I can't agree more with the idea of bringing people in to see hands-on what the operations are about. If you don't have a family member or you don't have a neighbor who has been receiving services, even understand what services are, you have no idea the amount of work that goes into this. And as Jennifer said, dealing with the most basic needs before we can even think about life needs. So thank you. Eric, you've mentioned some of the serious challenges for providers relative to the DSP crisis, which we all know. What solutions do you see to try and address these issues, especially from the state level? You see what's happening in each of the chapters. So can you share a little of that?
Sure. Thank you for the question. And some of the things I'm going to mention, Jennifer and the Assemblyman already touched on. But a lot of it comes down to funding and advocacy. So first and foremost, we have to establish a living wage for our DSP workforce. In statute is a cost of living adjustment, which is supposed to increase the rates that we receive as providers every year. We haven't received that cost of living adjustment in almost a decade. Unlike private employers, we just can't raise prices, right? We are not-for-profit providers. We're reliant on government funding. So we really rely on a cost of living adjustment to keep pace with increasing costs. The other piece of it is question of equality. We provide DSP services for individuals with IDD, and the state also provides the same services, but they do it for 40% more pay than we do because they're in a different methodology. So that's not really sustainable, and we're going to need to make that investment into our field. We also need to streamline regulations. I would argue to say we are one of the more overregulated fields. It makes recruitment and retention of our workforce very difficult. We are dealing with agencies like the Justice Center, which can penalize our workforce for just a mistake that is made rather than something intentional. So we need to find regulations that can be stripped away without adversely impacting our field and the people that we support. And then lastly, we really need to professionalize our field, as the Assemblyman indicated, creating a standard occupational code, identifying programs such as with BOCES, where we can teach skills necessary for long-term success in our field as DSPs. And also, many direct care workers lack access to a career pathway and advanced training opportunities. We're starting to see some growth in this area, but if we really want to professionalize our role, DSP roles, we need to make that investment, and we want to make this an attractive field for workers coming out of college or even at different phases of their life to join and discover really the rewards of a career in this field.
All right, thank you. Thank you. So Jennifer, I'm going to ask you a different form of question from an individual agency's perspective. Do you think there is anything about the actual workings of individual agencies that is missed or overlooked in the big picture organizations, fiscal policy, et cetera, discussions and decision-making that, if taken into consideration, would improve those decisions and discussion and outcomes, since you're looking at it from an individual agency perspective?
Sure. So Assemblyman Santa Barbara referenced a certificate program and professionalizing the field, which I absolutely support. I think it's a wonderful concept. From an individual provider's perspective, it's very difficult to engage with those kind of programs, to really scale them up. Right now, we have a Department of Labor apprenticeship program, which allows a direct support professional to become an apprenticed direct support professional. It's a program through our local community college, FMCC, where they get credits, college credits, and earn a certificate. At the completion of that, they're about halfway through to an associate's degree. It's a wonderful program, fully paid for. We pay for all the books, all of the tuition, everything. At the end of it, the direct support professional would get an increase in their rate of pay that, again, the agency is funding. We opened that up to all of our direct support professionals. As I indicated, I have about 550 direct support professionals. We were only able to engage 9 of them because it requires that they commit to something beyond their day-to-day job. That is hard to do when you're a single mother, taking care of kids at home, that type of thing. So even opening this wonderful opportunity up to hundreds of employees, I was only able to get 9 individuals engaged. We lost about 2 of them in the first year, but we still have that cohort going on to the second year. So I think these programs are wonderful. I just think There's a real challenge with scaling up programs like this, any kind of underemployed program, that type of thing, and just a recognition of those being a part of a solution, but they're not really something that's going to address the immediate day-to-day challenge. I think we've already kind of hit on that, which is the funding. That really is what's needed to address the day-to-day. And I would just encourage people to have a longer term perspective when they're talking about some of these other more challenging programs, which have wonderful results, but they really are a challenge to scale up.
Okay, thank you. So I'm going to switch a little bit and turn to Steve, because you mentioned, Steve, in your presentation, collaborative partnerships. How has Special Olympics New York had preliminary success with these proposed programs?
Thanks. First, I guess I'd want to say that the call to action for the voluntary private not-for-profit service provider is super important. If these solutions that I proposed had any value to them, they need to be in a position to take advantage. So I can think of two really easy ones to mention. The first being at UAlbany, we have two programs, one a campus rec unified sports or unified sport rec program, and also a partnership with Albany, on campus ABLE, which is Albany Business Leaders Emerging. They run a leadership program in partnership with us, and the campus rec is involved in flag football, soccer, basketball, and then bocce, because there's a broader audience of people who are interested in a sport like that. It's not as physically demanding. All of the athletes that are involved in that program are coming from the community, and in every single instance, it isn't a nonprofit provider that is involved. It's a community family. So the providers aren't really able, we have invited, but it's very stressful for them to find the opportunity to, and again, accessibility to venture out of a community residence or a habilitated program and attend, bring consumers, people with, and as athletes to our program. And that's one of those that I mentioned, that's an inclusive program. So the partners are college students. So it is a perfect pairing for a person 22 and over, because they're being partnered with college students who are interested in unified activity recreation, where they're having those unique valuable experiences in a peer group of people with and without. The other example that I can offer is municipal recreation. So across the state, we have many. One of the most successful that I can think of is Pittsford Rec in Monroe County. The program is almost exactly the same as a campus rec program, where people with and people without are partnered in a season of sports or recreation. And again, the sustainability, like it being a campus sport or it being a town recreation sport, the sustainability comes from the community involvement, the staff and volunteers that participate. And in that situation, there is just slightly more participation from the nonprofit private agencies, but it's only because they still have maintained recreation staff. And so the majority of the people that are involved with IDD are coming from families, but there is one agency that maintains a rec staff person, and that's no longer funded. They have to be creative in finding funding for that because of the ongoing stress that's placed on this support system for people with. So those are the two examples that are both sustainable, readily accessible, only challenged for people that are 22 and over.
Right. And the challenge, and I'll open this up to everyone on the panel, the challenge is really dealing with the day-to-day crisis and then adding these enhancements to the program to allow for such things as recreation, transportation, because I know those things are many times not funded through the state or federal government. So it's almost like we have to deal with that first level of need. I think when we were talking separately, you were talking about the Maslow's hierarchy. You got to deal with those foundational levels of making sure they're safe and well cared for, and that the staff is there on the ready to be able to do those kind of things before we can even think about enhancing their life. And that's the whole purpose why all of us are in this industry, is to make a better life for those of us who we love. I'd like to open now, Ed and Dean, if we could. Does anybody have any questions or comments back to any of our panelists from the panel itself? I kind of went quickly through your questions, but does anyone have any comments or to any of the topics that we talked about from the panel itself before I open it up to the floor? No? Okay, so Ed and Dean, you're in charge of our participants, and if they have any questions, if not, I have other questions, but I want to make sure I open it up to the floor.
Okay.
There's
yes,
one
so
from
please
Chris.
use the raise your hand feature or the Q&A and chat. And looks like we have one question already, Dean.
Yes, from Chris, and I'll allow him to talk. Chris, just there you go.
Okay, you can hear me.
Yes.
Okay, during the financial crisis, banks were subject to things called stress tests, and some banks were pretty healthy, and other banks were in dire straits. Now, Jennifer, you mentioned that you're now caring for 550 people. What was that care population 10 years ago? And Steve mentioned a decrease in adult participation in Special Olympics. Is this a demographic shift? And Eric, you with some statewide experience, you might see some gradients across the state. Do similar facilities in downstate suburban Long Island suffer similar dire stories that were shared here in rural declining population upstate New York?
So anyone who
Go
wants-
first. I'll jump right in. So we are serving right around the same number that we were serving 10, 15 years ago. We have always historically been able to fill our beds. I mean, not to be morbid, but typically we have openings only upon the death of a person we're supporting. And we've always been able to fill those pretty easily. We typically have a waiting list. We are a very high quality provider, which I think helps us with our reputation and things like that. The past 2 years have been the only period in time in which we have held openings. I actually proactively, quote unquote, closed a house temporarily. So I am not backfilling those openings because frankly, I don't have the staff to be able to take on new individuals into those homes. We also, as an agency, have grown almost every single year. So we're constantly growing, adding new residential opportunities, expanding, taking people in referred from other counties in the state. Similarly, our operation in the state of Delaware has remained very consistent in its size. As we had an individual pass away, we would just admit somebody else off of our waiting list. Again, Delaware is struggling with referrals. It's partly driven by COVID and by people not wanting to move their individual out of a family home during COVID. But it's also related in the state of Delaware to staffing as it is up here in New York. We're really struggling to fill vacancies, which makes it very difficult to fill our openings. And so we've sort of held on a few of them down there as well.
Eric, do you have a comment?
Sure, it's a great question, Chris. We've actually seen challenges no matter where people have been impacted, if it's rural or urban. Some of the challenges are different, but we all had the same financial challenges as a result of COVID. I mean, we weren't prepared, and I'm not saying our providers, I'm saying in general, no one was prepared for COVID-19. We certainly didn't have the stockpile of PPE and all of those elements that we needed. So we paid extraordinary prices. And so our downstate chapters were paying those same prices, and they were just buying more than a rural county. But where we really, I think, started to see some of the impact was as programs started to close and we weren't able to transport people. I think rural settings struggled more significantly because it's very spaced out, a lot of mileage between programs. You take away transportation from some of these rural locations, and people are literally stuck in their homes for months on end. So we saw increases in a lot of behavioral situations, some mental health issues, depression, dysthymia, things like that. So there were some regional differences, but I would say the struggles were pretty consistent throughout the state.
Steve, I think part of the question was also directed to you.
Yeah, I think Chris had mentioned demographic shift. And so that's correct. So Special Olympics at its core, and at some of the times when we served the largest community base, back in the 90s and the early 2000s when recreation was still funded, and when staffing was not in crisis, and then the decline has been slow and massively accelerated during COVID. And I think it just demonstrates the stress that our collaborative, partners in the community agencies is facing.
Steve, do you have a follow-on?
Pardon me?
I'm sorry, Chris, do you have a follow-on? I apologize.
Thank you very much. No, that kind of addresses my my question about maybe we can learn something from changes among different institutions. And Jennifer, I really liked your contrasting what's happening in Delaware with what's happening here. Maybe what works at some facilities, even though it's bad news everywhere, it might be less bad news somewhere else for some reason. I don't know. I guess I'm just curious if there's a silver lining.
Well, Eric, can you talk from the standpoint of us being, I'm sure most people don't realize the structure of the ARC, but we are one organization within the national. Can you talk a little bit about how we compare and contrast to what's happening across the United States with our colleagues?
Well, it's a little difficult because it's kind of apples and oranges. I mean, you look at ARCs in other states, they typically are not providers. They're more advocacy
That's right.
agencies. So we're very unique in that not only are we an advocacy entity, but we also operate services for, over 60,000 people. So it's hard for me to compare what's going on in New York and at our providers versus what's happening in other states.
Is there any other states that have provider ARCs? Does California, or is that an advocacy more so?
I'm not totally sure. I could certainly find out and get back to you. There's probably a few, but I would probably venture to guess that they don't offer the same scope, the breadth of services that we do.
Okay. Jennifer, do you know from the Anchor or from any other organization?
Sure. So Anchor is a National Association of Provider Organizations. As Eric referenced, the US ARC has a much stronger focus on advocacy, representing people with disabilities, their family members, as well as providers, but providers are not their core focus. Anchor's core focus at a national level is providers. So I do serve on Anchor's board. I will share that our challenges are not unique as far as staffing and funding. That's not unique for New York State. New York State does tend to be much more highly regulated. And I also would share that other states have been more generous in compensation for direct support professionals in recent years. For instance, Maine has now linked their funding for their providers to the minimum wage of Maine and is paying direct support professionals 120% of minimum wage through their providers. Illinois is doing 150% of minimum wage. So other states have been a little more aggressive in the funding already for direct support professionals. But universally, there's staffing challenges. There has been historical underfunding of direct support professionals. There is the lack of this professionalization of DSPs. So there isn't a certificate program. There isn't a consistent apprenticeship program throughout or across states, that type of thing. So it's not unique. New York, what New York is unique for, which I'm sure most of the people on this today realize, is that we like to really regulate everything. So we will regulate anything and everything. One of my favorite examples is to share that every single residential home is required to have a thermometer in the freezer. So even if I have one individual living in his own apartment, I have to have a thermometer in his freezer that the staff know what the temperature is of that freezer. Not really a reasonable level of regulation, but New York is very good at it. So,
Thank you. Do we have any other hands? Dean?
Yes,
Another question.
David. Pardon me? David has a question. Dave, you can unmute.
Hi. First of all, this was really an excellent panel. I learned a heck of a lot today. And as an aside, I have to agree completely with Jennifer that New York is so heavily regulated. It's unbelievable. I think this is a question for Assemblyman in Santa Barbara, because I think he was the person who mentioned federal monies that might be available. I might be misremembering who talked about it. But, and I think the mention was that there were funds that the federal government had made available to the state, but have not yet been allocated, and whether any of that would be coming to agents like ARC or Special Olympics or any of that sort of thing. But it's really a more general question about whether, for example, this human infrastructure bill that's still getting bounced around is likely to provide any kind of funding that would be supportive, or any other federal department that is provide or might be likely has a potential of providing monies that would be useful for all of you.
So no, I don't think it was me that mentioned that, but I did write a letter to Congress also advocating for their support as well. I don't know if it was Jennifer or who brought the federal funding up, but in any case, I think that you know, there is funding, I think, that can be used to support you know, what we're talking about here today. It's just a matter of who administers those funds, because the funds come down from the federal government, and there's you know, there's I guess pots of money for a specific purpose, and it's just a matter of you know, deciding how you're going to disperse those funds in our communities and across the state. So I think the answer is yes. I think there is funding that could support what we're talking about here today. And I don't know if that's the governor's office, or when we get back to the legislature to some degree, you know, how we can get those funds through, and where exactly they will come from. They might be several different sources. I know there was a new, you know, these federal bills that come down, they're just humongous. And there's funding for all sorts of purposes in there. So I think the answer is yes. Again, I've written letters to our governor, but I've also written letters to Congress, you know, asking for support on some of these issues, and describing some of the challenges that we're talking about here today, right from the start of COVID. You know, very little support to even get through. You know, just simple things like, you know, trying to find masks and gloves, and you know, trying to have the basic needs that everyone else had support for. And you know, we find ourselves taking, you know, I hear people taking money out of their own pockets just to, you know, keep up with what they needed to do. So you know, that's the part that's just not right about this. But hopefully we'll see some of those funds come through to support this. But again, I'm more of the, it's great. I want to see those funds come through, and I want to see the support. But I think our long term, and I think Jennifer put it nicely, that you know, we got to think long term here. You know, it's great if we get funding for some of the problems we're talking about. What about next year? You know, what about, you know, we've had so many rallies and so many, you know, been up at the Capitol so many times. And it seems like, it shouldn't be a process like this that just so much uncertainty. And I think that's what keeps people away too, is that it's uncertain. We don't know. We just don't know what's going to happen year to year. So people are reluctant to either stay in the position or even seek a career opportunity in that position. And back to your point, Jennifer, maybe, that's part of the reason why maybe some people didn't take advantage of that career certificate program, because, you said you lost a few of them, eventually end up losing a few of them. And maybe that was the thought, that they're just not confident enough that they want to make that investment of time and energy to get that certificate and then not be sure what's coming next. So I think, the number one thing needs to be the funding, for sure. The funding needs to be resolved. It needs to be consistent, it needs to be long-term. And then down the road, sort of professionalize. Once we have all these other issues taken care of, I think there's a good opportunity to sort of get to the next level with these certificate programs or career opportunities. But without some sort of, people have to have confidence that, I'm going to get into this and I'll be able to support my family. I'll be able to, pay my bills. I'll be able to do, I'll be able to do things I want to do in life. I'll be able to, the other part of it, and probably Jennifer could speak to this, is that, how many people are working more, taking on, because there's vacancies, taking on twice as much work or 3 times as much work, and have to work the overtime. They're not able to even go home and, just enjoy some time with your own family. That takes a toll on people. So I think that answers the question. I don't know if anybody else wants to chime in on the federal funding issue.
Well, I think one point that you made, Assemblyman, is the fact that many of our DSPs are working 2 jobs to support their families because they can't make enough on the one salary. And that then diminishes their ability to be present when they need to be present in the homes that they are assigned to. We are getting close to the end of our webinar, but I wanted to take a second as far as a final thought. If anyone could share, what is the next steps that we should do as a community? We're all here as a community member, not only people who have worked in the field, but we're also as community individuals trying to make our communities be stronger and more inclusive. Last thoughts, final thoughts that you could share with our participants as far as what you would love them to do to help move this topic forward. Anyone?
So I'll jump in quickly, but advocacy, reaching out to your elected officials at the state and federal level, making them aware of the challenges that our field is facing and the opportunities where we're going to need their support. So from my perspective, it's all about advocacy, and I would ask everyone who attended today to please pick up the phone or the email or even the old typewriter and let's get word out, because we have to make that, we got to make that push.
Okay. Anyone
And,
else?
I'll just add to what Eric just said. Advocacy comes in many different forms, and I think actually Liberty does a great job of this. They show these little videos on Facebook and these success stories, and just inviting people to share with their success what they've been able to do. And I think we can all do that. And if you have a chance to share a story or talk about what direct care has meant to your life, it's great to put that out there. And and as I said, there's 63 senators, 150 assembly members. They don't all know what we're talking about here. They don't have the direct experience. So it's our job to bring that to them. And I think sharing the stories, and we've done a better job at this, because years ago, I think people wouldn't share. They just wouldn't talk about what we're talking about here. They just didn't do it. But now I think more people are doing that, and they're comfortable, and they know that we want to build a community where everyone is supported, no one is left behind. And I think to do that, we have to advocate. But just remember, it comes in many different ways. And sending emails and letters is, we can do that, and that's great. But I think the more personal you can get with those, share your personal stories. I think that's the way to go. And as I said, I'm just going to reinforce. There's ARCs all across the state. There's legislators all across the state. Maybe they've never been there. If you send the invitation, they're likely to say, all right, I'm going to make time. Have them come and get, show them what the work that goes on. Talk to direct care in the setting that we're talking about here. I think that will go a long way.
Thank you, Assemblyman. I couldn't have said it better. Each ARC is looking for members, so I always push that if you are at all interested in this topic, you don't have to have a family member to be a member of an ARC to help with advocacy. I want to take the last 2 seconds to thank our panelists and thank Ed and Dean and the Emeritus Center for allowing us to have this panel and this very important topic, timely topic, especially as we start our new calendar year. So please consider joining a chapter, consider advocating on behalf of a chapter or on behalf of any individuals. I think our elected officials need to hear from us. Ed and Dean, any last words? We're down to 2 minutes.
Yeah, it is approaching the 3 o'clock hour. Again, I just wanted to reiterate what Donna said and thank the panelists for their time and effort. I agree. I think it was an excellent program. And Donna, thank you for all the time and effort organizing this. It was not an easy task, but you pulled it off. And
Something near and dear to my heart, so.
yes, and finally, for the audience, our final webinar of the year is coming up in 3 weeks, December 6th. And I think it's a very special program, a nice way to end the semester. Dean, do you want to just briefly tell folks what to expect on December 6th?
Yes, it'll be another special event as today was. I've learned so much, so thank you all for me. December 6th, we have Dr. Christopher Gibson, president of Siena College, joining us. He's going to talk about From the Military to Congress to College President, a conversation with Siena College President Chris Gibson, and with an introduction by our president, Javidan Rodriguez. So that should be fun as well. And just thank you all so much. I learned a great deal. I actually took notes, and I appreciate every one of you. Thank you, Donna.
Thank you all. Have a good afternoon.
Okay.
Thank you all very much.
Goodbye.
Bye-bye.
Take care.